Who here has ever heard of a school resource officer? Half of you guys. Okay. So basically, I'm the point of contact between the police department and the school district. Anytime that there's an incident involving any student within the school district, I communicate with school administrators, the district office, and advise them of the issue. I also in constant communication with all the campuses regarding any incidents that occurred nearby any campuses during the weekends or during school hours, so they could take the appropriate action to ensure the student safety. I'm here on campus to enhance the security and to establish a safer learning environment. I assist to handle any incidents requiring police response on school campuses, not only involving students, but also involving staff and other employees of the school district. I handle any incidents affecting the students' well-being, whether it's any bullying issues, substance abuse, and use, and issues occurring at home. I also host educational and safety events and visits with children of all ages. As I said, I talk to 3-year-olds all the way up to 8th graders. I establish a positive image of law enforcement with all the kids. I participate in various community-based programs in the prevention of underage substance abuse, and I participate in the juvenile diversion program, which I'm going to touch on just a tad, and we have another speaker here who will go more in depth, Joan Jenkins, into the juvenile diversion program. So as a school resource officer, there are very creative of me. There are 3 substances that I come across that I notice that are widely used by teens here in Manhattan Beach. The 3 substances are alcohol, marijuana, to include edibles, and prescription medication. So alcohol. Alcohol is the #1 problem that we have amongst our youth, not only here within our community, but nationwide. Nationwide, there are 8.7 million young people between the ages of 12 to 20 admitted to drinking an alcoholic drink within the past month. Most alcohol is consumed in these age groups in the form of binge drinking. Binge drinking, of course, can lead to risky behavior and alcohol poisoning, which can lead to death. Marijuana and edibles. 1.8 million young people between the ages of 12 to 20 began using marijuana within the last year. The use of substance in this form of marijuana is, of course, smoking. You've heard of joints, blunts, vaporizers, and ingesting of baked goods and other foods. Edibles. How many of you have heard about edibles? Okay. That seems to be the new trend going around now in the consumption of THC and marijuana. Edibles, popular form of consumption, and have high levels of THC. Because they're masked as baked goods or other types of food, it doesn't give the odor of marijuana or of THC. You can find, or you can notice that edibles are in forms of brownies, cookies, chocolate, lollipops, several different forms of foods. And of course, prescription medication. 90% of prescription drug addiction begin in the teenage years. 1 in 5 teens abuse prescription medication, and the top medications that I come across are 2, Vicodin and Adderall. Many teens believe prescription medication is safer as street drugs. That's why that number is so high. Now, what exactly do we as police officers, which I am a full sworn police officer, do in order to enforce juveniles and to prevent them from using substances? We have several different options when we come across a juvenile which is under the age of 20. We could either issue them a citation or arrest. There are several state laws that are in place to prevent substance abuse. So if we do have the option or choose the option of issuing a citation or arrest, they will come across fines, court appearances, and be assigned a probation officer. Here in Manhattan Beach, we have a wonderful program that was established just a few years ago in 2012. It's called the Juvenile Diversion Program. That is a program that is led by Joan Jenkins, and it's aimed at helping and preventing youth from entering the juvenile justice system. We don't want our kids who make the mistake of beginning to use substances at an early age to go into the juvenile justice system. It could hinder a lot of things later on down the line, college admissions, jobs, you name it. Numbers down there. And you'll see later on down in this presentation that we don't issue a lot of citations to juveniles or arrests. We mostly refer all of our cases involving drugs or alcohol to the Juvenile Diversion Program, which is about 65% of all our cases. Now, there are also state laws that prevent adults and parents from providing substances to juveniles. And these are just two of them that can lead to a citation or arrest. There's a Penal Code 272, which is contributing to the delinquency of a minor, and Business and Profession Code 25658, which is furnishing alcohol to minors. Both of them are misdemeanors, and both of them can lead to fines and time spent in the county jail. Here in Manhattan Beach, it's another unique city within the South Bay that we have what is called a social host ordinance. Have anyone heard of a social host ordinance? Okay, about a quarter of you. What a social host ordinance is, it's a local law that was implemented within the city that we would hold the adults responsible for providing an environment that allows juveniles to consume alcohol. So we go after the parents, we go after the responsible adults who allow parties to happen on their property. And these fines are out there. So what do we see here in Manhattan Beach? These are the numbers of citations and arrests from 2013 to now, 2016. As you can see, they're up and down. All alcohol-related offenses, which include possession, purchasing alcohol, and the highest that we saw was in 2014, which was 40 citations and arrests. This year, we're up to 4. DUI, that number I feel is a little too high, but that is what we came across. From 2013 to 2015, we have 12 arrests for those under the age of 20 who were DUI. Being drunk in public includes alcohol and drugs such as marijuana. This year we're up to 3, and possession of marijuana, this year we're up to 0, but of course that's going to change. Even though these numbers may seem a little low to a lot of you, officers use discretion when they come across juveniles who are either under the influence or in possession of alcohol. And like I said, most of our cases are referred into the Juvenile Diversion Program. Social host ordinance, adults that were issued citations. The highest that we saw was in 2013 with 9. This year, so far, is 2. As I said, 2016, we're just 5 months into the year. Summer's coming, so I expect that number to be higher. Now, what are we doing as law enforcement, and what are you guys going to see on school campuses is to prevent the use and abuse of substances is we're educating our students on the dangers of drinking and using drugs. We're talking, or I'm talking to the students and letting them know the consequences that come with the use and abuse of substances. And how many MBMS parents do we have here? Okay. You guys were made aware of a canine search that we had, was it last week? Okay, we're starting to bring the canines back on campus in order to prevent students from bringing illegal substances on campus. And these canines that we bring on campus not only detect marijuana or illegal drugs, but they also detect alcohol and firearms. So my advice to you, and to close this off, is talk early to your kids, talk often to them, listen to them, know the early warning signs of substance abuse, and if you do feel like your child is using or could be using substances, get others involved. There's a lot of professionals out there who are willing to help your family out. So, in case you guys want my information, like I said, I'm here full-time on MBMS campus. I have my contact information both from the police department and from my office here at the middle school. Thank you.